Thank you for viewing this Access in Medicine video about some of the main categories of disability. In this video, we will discuss the categories of disability, the forms of documentation a student can provide to substantiate their need for accommodations, and finally, common accommodations used in medical school to meet the needs of individuals within the category. The information in this video is sourced from Chapter 2, Disability Law and the Process for Determining Whether a Student Has a Disability in the book Equal Access for Students with Disabilities, the Guide for Health Science and Professional Education. This book is available for free digital download on the DocsWithDisabilities website. We thank the authors, Elisa Laird and Gregory Moorehead, for permission to use their important work. The following are categories of disabilities covered under the ADA: learning, hearing, vision, ADHD, psychological, physical mobility, and chronic illness. An individual with a disability is defined by the ADA as a person who has a physical or mental impairment that substantially limits one or more major life activities, a person who has a history or record of such an impairment, or a person who is perceived by others as having such an impairment. Using this definition means that on its own, a diagnosis does not automatically mean a disability is present. Disability is a spectrum. Not all disabilities are visible, and each person experiences their disability differently. A disability resource professional determines whether the condition interferes with a major life activity that affects the student in the educational environment based on relevant information from healthcare providers and the student. If the condition does not limit a major life activity, no accommodations are needed. The first disability category we will cover is learning disability. A learning disability affects the acquisition of knowledge or skills, in particular, any of the various neurodevelopmental conditions affecting the learning and use of specific academic skills, such as reading, writing, or mathematics. Learning disabilities may include specific learning disorders in reading or math, dyslexia, dysgraphia, and processing disorders. Medical students may submit a current neuropsychological report to their disability resource provider to support accommodation requests due to a learning disability. The report should be written by a qualified professional with expertise in learning disabilities, training in administering tests used, and experience working with adults, such as a licensed educational psychologist, clinical psychologist, or learning disabilities specialist. A medical student may be impacted by their disability while testing, reviewing door notes, or preparing for a patient on the wards. These are a list of common accommodations often granted for students with learning disabilities: extended testing time, extended time for door notes during an objective structured clinical exam or OSCE, text-to-speech software, note-taking support, such as a note-taker, use of a smart pen, audio recording, and use of a note-taking app, and/or speech-to-text software. Next, we will discuss hearing disabilities. Hearing loss can be mild, moderate, moderately severe, severe, or profound, and it can affect one or both ears. Learners with hearing loss may provide audiological reports to their disability resource professional. An audiological report describes the functional limitations a student experiences because of their hearing loss. Hearing loss may impact a student's ability to capture all lecture material, input from fellow classmates, patient information, and other critical information without proper accommodations. A student with a hearing-based disability may need the use of CART, or communication access real-time translation, a sign language interpreter, copies of class lecture notes, or the use of amplification across the classroom, lab, and clinical spaces as possible accommodations. The next category is visual disability. A vision disability refers to a partial or complete loss of vision that cannot be corrected by standard eyeglasses, contact lenses, or medical treatment. This category also includes color vision deficiency, CVD, otherwise known as color blindness. A student with a vision disability may provide their disability resource professional a form or letter by a treating physician describing the type and extent of their vision limitations. Visual disabilities may impact a student's ability to interpret charts, graphs, and access to visually presented information. Students with vision disabilities often rely on techniques and tools to access information and navigate the world around them. These may include the use of assistive devices like magnifiers, screen readers, and braille displays to engage in reading and writing during didactic and clinical experiences. Additionally, individuals with vision disabilities may also need to work with a specialist to learn various adaptive strategies and skills to make observations or perform necessary maneuvers during clinical experiences. The next category is attention deficit hyperactivity disorder, or ADHD. This is a neurodevelopmental disorder and is characterized by persistent patterns of inattention, impulsivity, and hyperactivity that interfere with daily functioning and development. A student may provide their disability resource professional with a psychoeducational testing report or a written assessment from a treating provider verifying the diagnosis and describing how the symptoms substantially limit a major life activity. Students with ADHD may have difficulty with multitasking, organizing tasks, remembering instructions, and maintaining attention. This can impact medical students who need to work at a fast pace in a busy environment during their clinical experiences, or who need to concentrate intensely for hours at a time to perform well on high-stakes exams. One example of an accommodation for a student with ADHD is to take their exams in a low distraction environment. In some cases, taking breaks in lieu of extra time may better address the barriers associated with time. For example, students with ADHD may not benefit from additional time and instead may need to take periodic breaks to move around or refocus their attention before resuming an exam. A student with ADHD in a clinical experience may need to record audio of patient history or instructions to accommodate for deficits in working memory. The next category of disability is psychological disability. This is a mental health condition that can be either permanent or temporary in nature that impacts daily life functioning. A psychological disability can include, but is not limited to, anxiety, depression, schizophrenia, or eating disorders. A student may provide their disability resource professional with a form or letter from a treating healthcare practitioner whose scope of practice includes the disability and who is licensed to make a diagnosis. The document typically confirms the diagnosis and describes the functional impacts of the reported disability, including how the symptoms impact learning and interacting with patients. A medical student may be impacted in the classroom, while testing, or while interacting with patients in the clinical environment. A student with a psychological disability may require extended time to take exams, a semi-private or private testing space, breaks within exam time, or protected time to attend therapy appointments. The next category is physical or mobility disability. This is defined as a physical disability that impacts movement and can include impacts on gross and fine motor skills. A medical student may be impacted during their standard patient exams, examining patients, or navigating clinical experiences. A student with a mobility disability may require break time during clinic or access to adaptive equipment. A student with a mobility or physical disability may provide their disability resource professional with a written letter or report from a treating provider that verifies any non-apparent diagnosis and describes how the symptoms impact their functioning as a medical student. While in school and training, some examples of how a medical student may be impacted by their disability are maneuvering on the wards, accessing the visual field, or adjusting the position of a patient. A student with a mobility or physical disability may require the use of specialized equipment, such as a wheelchair or a scooter to navigate clinicals. Additionally, they may need to sit or stand as needed or use an intermediary to help assist with tasks. A student may also need support coordinating specific parking needs, both at school and at their clinical site. The final category of disability is chronic health. This is defined as chronic conditions that require ongoing medical care and that limit daily activities. Examples of chronic health conditions include, but are not limited to, migraine headaches, cancer, diabetes, multiple sclerosis, heart disease, and arthritis. A student with a chronic health condition may provide their disability resource professional with a written letter or report from a treating provider, describing how their symptoms impact one or more major life activities. A medical student may be impacted in the classroom while testing or while interacting with patients in the clinical environment. A student with a chronic illness may require occasional breaks, priority scheduling of clerkships, extended time to take exams and complete assignments, note-taking assistance, flexible attendance, and the use of technology to fully access the learning and training environments. These were the resources used to create this video. This video is a product of the DocsWithDisabilities initiative and their Access in Medicine program. It was made in partnership with the University of Michigan. For additional resources and information about the DocsWithDisabilities initiative, please visit the DocsWithDisabilities initiative website or follow us on YouTube, Twitter, and Instagram.